I'm Dr. James Jenkins. I am a staff psychiatrist at McLean Hospital. I work at the Gunderson Residence. The greatest misconception that is out there about borderline personality disorder is that people cannot get better or that borderline personality disorder is untreatable, when in fact we know from research that borderline personality disorder has very good outcome. When there's some kind of treatment intervention, the vast majority of people with borderline personality disorder actually will achieve remission of their symptoms. Now, the caveat to this is, despite the fact that from a behavioral standpoint, things like suicidality or self-harm or self-injurious behavior, some of these impulsive or reckless behaviors will get better over time. From a functional standpoint, people with borderline personality disorder without treatment oftentimes will look pretty similar to people that have chronic and persistent mental illness, so people with schizophrenia or bipolar disorder. But we know that with good psychiatric treatment, especially with good case management, that even that is something that you can have much more favorable outcomes than what a person might sort of assume just based on what's believed out in the psychiatric community. It can be very difficult to diagnose, and there are all different kinds of myths, and there are many different things that people get distracted by in the consideration of the diagnosis. A couple of the different symptoms of borderline personality disorder include a chronic sense of emptiness, intense periods of anger or dysphoria, episodic periods of really intense emotion. People with borderline personality disorder will have periods where they feel very disconnected from their emotions. And when they're in that state, they can have symptoms where they can feel disconnected with reality, numbed out. They can feel like things are not real or distant or foggy, within a spectrum of symptoms called dissociative symptoms. Because people with borderline personality disorder have difficulty controlling their emotions, internally, oftentimes what ends up happening is they tend to use external things to control their emotions. So things like substances, sex, risky behaviors. So impulsive behaviors, suicide and self-harming behaviors. So this is the behavioral sort of dysregulation that you see with people and the impulsivity that you see with people that have borderline personality disorder. The unfortunate reality is that oftentimes people are very conflicted, or they have a lot of ambivalence when they make these suicide attempts. But there's this escalation that happens over time in the seriousness of it in order to get their needs met and to feel sort of attached or connected to someone else, that eventually at some point in time people will accidentally oftentimes end up going forward with what otherwise would have been an ambivalent suicide attempt. So all of these behavioral manifestations really arise out of poor impulse control and problems with emotion regulation. And then the last sort of cluster of symptoms has to do with really exquisite sensitivity to rejection, and this idea that people with borderline personality disorder are very hypersensitive when it comes to interpersonal relationships and are very prone to feeling rejected or abandoned. And so they can be preoccupied with the state of a relationship and can do many things to try to avoid the loss of a relationship. Because it's when they have a stable relationship, many of their symptoms are actually much lower and their ability to tolerate emotions is improved. And so what ends up happening is, because that can be very gratifying to them, they'll oftentimes do anything to try to avoid the loss of that kind of relationship and will become very fearful of the loss of their relationship. One of the really interesting things about borderline personality disorder is the amount of neuroscience that we have supporting the diagnosis and helping to enrich our understanding of the diagnosis. I think some of the key points that might help guide one's clinical practice and help understand What's going on in the brains of these individuals are the threat detection system for these individuals is basically always on. People that have borderline personality disorder have a very difficult time accurately perceiving social inclusion. So they've done studies looking at the brains of individuals with BPD during tasks when they're participating in different activities where they're either included or excluded from social games. And one of the things that they find is that people with borderline personality disorder are more likely to feel excluded, even if they're being overly included. There are a variety of different evidence-based treatments. What they all have in common is not making the patient worse and paying very close attention to holding very tight expectations and accountability in the treatment. There are a number of different treatments that are available. The thing that unifies all the different treatments are goals for treatment, some sense of accountability in the treatment, to incorporate the client as an agent of change in the treatment, and to try to increasingly have them direct their own treatment. People with borderline personality disorder have a tendency to sometimes be more passive in their treatment, and it can become very problematic to reinforce that dynamic. The other thing is to have a relationship that is therapeutic and boundaried, but also real and human and compassionate. One of the things that you learn very quickly in treating people with borderline personality disorder is that because of their very emotional sort of system, they're very good and very adept at sort of picking up on disingenuousness. The more sort of direct that you can be in the treatment, the better, and the more active you can be in the treatment, the better. Good psychiatric management is a treatment that is unique as far as the different evidence-based treatments for borderline personality disorder goes. It's designed to be incredibly adaptable, and it's designed to be very low resource. It's interesting and different in that good psychiatric management is a treatment but not a psychotherapy. And what that means is that there are principles to the treatment and guidelines to the treatment, and that's a part of what gives it its flexibility. It's also a part of what makes it easier to learn, and it can be adapted to inpatient environments, to outpatient, to emergency rooms, to medical settings, residential settings. And it's also adaptable to physicians, social workers, nurses, nurse practitioners, and the amount of time and resources that it takes to become proficient is substantially less than the amount of time and resources that it would take to become proficient in one of the psychotherapies. And when we look at how GPM, or good psychiatric management, compares to those other treatments, it does just as well. And as the amount of complexity or comorbidity goes up, it actually looks like it outperforms at least DBT, dialectical behavioral therapy. The model for GPM evolved out of a recognition that in a lot of the research looking at a lot of the evidence-based psychotherapy studies, people who were in some sort of controlled, structured clinical management, where they were meeting with someone on a weekly basis, but not receiving the active psychotherapy, were not doing too poorly. In fact, they were actually doing better than the waitlist controls. Being a sort of consistent, stable presence in the life of someone with borderline personality disorder and holding them to some level of accountability and doing good case management can be extremely therapeutic. It has a model of understanding the phenomena of borderline personality disorder, which at its core is based on the idea of borderline personality disorder as a disorder of interpersonal hypersensitivity. And that means that people with borderline personality disorder are people that are very, very, very sensitive to ruptures in interpersonal relationships or attachments or relational losses, and that those relational losses can oftentimes lead to predictable changes in emotional state and behaviors. And so the treatment uses that model to help sort of guide, plan, and prepare for things that naturally arise in the treatment of individuals with borderline personality disorder, so that a person can be proactive in the treatment and keep a focus on accountability and change, rather than having a treatment kind of unfold in a very reactive way, which can be very harmful and detrimental to people that have borderline personality disorder. One of the really important things to consider in the treatment of borderline personality disorder is the necessity to prioritize some kind of vocational engagement as the top priority in treatment. There will always be a tendency in the treatment of these individuals to prioritize a relational component. So they'll come into treatment and oftentimes a goal will be to have a better relationship with a partner or a spouse, to have their spouse change in some way. I think it's really important to keep the focus on vocation and functioning first and foremost, prior to getting into the more relational thing, because there's more sort of heat and friction in the relational area. And if you can stabilize someone from a functional standpoint, it's much more likely that you'll have traction and success when you get to the relational component, even though it's still going to be difficult to help improve. And when I talk about vocation, that can look very different for different people. Many people are on disability or they're on SSI, and so maybe that's picking up a grandchild every day from the bus stop. Something where they have to show up for someone else that helps them to break away from mood-dependent kinds of behaviors and gives them a source of pride and starts to give a sense of identity and confidence and mastery. These things really, really cannot be underestimated in the treatment of these individuals. Seeing the improvements in functionality and seeing the evolution of the relationship over time as they recover and remit from the disorder, and they make progress towards their goals and towards building a life that's more sustainable and more gratifying, is tremendously rewarding and is not something that can be underestimated.
Thank you for watching this video, and we would love to share more with you. So please subscribe to this YouTube channel. For more information about all of our trainings, please visit the link below.